I wasn't being listened to, my feelings, my autonomy. I walked away from this experience just traumatized.
Breonna Taylor still struggles to talk about her experience giving birth to her daughter in 2019.
During the most vulnerable and crucial moments of my entire life, my care was mishandled by those that I was supposed to have been able to have, the utmost trust and confidence in. So now when it comes to the vaccine, I'm definitely hesitant.
The 20-year-old runs an Instagram page called Black Motherhood Collective. In a recent post, she aimed to shed light on why she and so many others are wary of the COVID-19 vaccine. Troubling stats like this one from a 2018 study out of the U.S. show that 84% of pregnancy-related deaths were Black women.
Anybody who has any sense of the history of the healthcare system and the Black community would totally understand why any Black person would be hesitant when it comes to the vaccine.
While Black people may not be the only ones hesitant about the vaccine, they may be more likely to be. A survey by Ecos Research in December found 32% of racialized respondents said they would not take the vaccine, compared to 21% of non-racialized people. But the stakes are high for neighborhoods like this one in Toronto's Northwest End. The predominantly Black and brown community has been a COVID hotspot since the start of the pandemic. One look around, it's not hard to understand why.
And they have to go to work every day. They're essential workers, many of them.
Toronto's Black community has been hardest hit. Black patients making up a quarter of hospitalizations from COVID-19, the highest of any race group in Toronto, despite being just 9% of the population. One would think that would make Black Canadians eager for access to a vaccine. But community advocates say skepticism abounds.
When we talk about vaccines, again, there's that mistrust. Something will now be injected into your body. Can we trust that substance? Can we trust what's happening?
Cheryl Prescott, the executive director of the Black Creek Community Health Center, says this fear of the medical system comes from a very real place.
We know that, studies were done in the Black community, for example, by public health agencies in Tuskegee, for example, where Black men were engaged in the syphilis study. And that's something that folks know, and I think builds the mistrust.
The Tuskegee syphilis study experimented on Black men in Alabama over 40 years without their consent. Experts say understanding the historic and present-day systemic racism in healthcare has to be addressed as the COVID-19 vaccine is rolled out.
It's important to ensure that the messaging relating to vaccine prioritization is appropriate and is very transparent and very clear, so that there's no misinterpretation of intent. In other words, there's no perception that they're being used as guinea pigs.
Dr. Upton Allen is head of infectious diseases at the Hospital for Sick Children in Toronto, and he's been meeting with government officials, encouraging them to create specific strategies targeted at vaccine rollout in the Black community. What are some of the things that you hear from people in the Black community that creates a barrier for them to want to take the vaccine when it will be available?
Number one is a trust of the healthcare system. Second is misinformation, or just people getting wrong information or data that drive their decisions.
There are quite a few questions in the chat, so...
In the meantime, community groups are being proactive.
I can tell you, though, that I know people who've been vaccinated and they've been okay. So
holding information sessions like this one, hoping they can help get them ready for the vaccine when it's their turn.
That is so crucial that messaging gets out there, and it's being delivered by trusted individuals in the community.
For many, like Brianna, the responsibility still lies with those at the top.
Show the effort, make the effort, and let us know that this is something that you're very serious about and you're adamant about repairing the relationship and making sure that there is a level of trust between the Black community and healthcare professionals so that we can have confidence moving forward.
I love you. It's still unclear exactly when vaccines might be available for these impacted communities. Just today, the City of Toronto announced it will invest millions in a Black community COVID response plan.
So, Janella, what more do we know about the efforts local governments are making to try to address it?
Well, Adrienne, we heard today from the City of Toronto, $6.8 million in investment. That'll go directly to Black community groups who've already been doing this work, like Cheryl Prescott, who we saw there in her organization. And from the province of Ontario, they say phase 2 of the vaccine rollout, that'll include essential workers, like the people who live in those COVID-19 hotspots. Now, they also pointed out that last month they committed $12.5 million in funding for culturally sensitive community outreach in 15 high-priority communities. And they admit that there is a gap in data when it comes to socioeconomic groups and COVID-19, and that is still a challenge that has to be overcome. Adrienne.
All right, thank you, Janella. Janella Massa, host of Canada Tonight.